Hello, my name is Jay Hall. On May 15th and 16th of 2017, I'll be giving an APD workshop in Greenwich, England. I hope you will attend. Before I tell you about the workshop, I'd like to give you a little bit of background information on my connection to auditory processing disorders. As you know, may know, my mentor was Dr. James Jerger, shown here. And many years ago, in the early 1970s, over 40 years ago, James Jerger developed one of the first test batteries for evaluating auditory processing. And I was in the clinic at the time, and I began to appreciate the importance of evaluating auditory processing in each and every patient. Since then, I've run clinics at various universities and conducted diagnostic assessments of children and adults with auditory processing disorders, and I've also handled their management. Now, with the workshop that's coming up in May, we're going to begin with a discussion of the risk factors for APD. Many of you probably think that you don't see patients with auditory processing disorders, so maybe this information is not going to be all that useful to you. Well, let me just give you some statistics. If you see 10 children in your clinic who have evidence of hearing problems, in other words, they think they have a hearing problem, or their teacher does, or their parents do, and then their hearing sensitivity is normal, their audiogram's normal, you can be quite sure that at least three of those children actually have auditory processing disorders. So if you're seeing children in the clinic and some of them have normal hearing, I can assure you that you are missing some of the children who have auditory processing disorders. Now let's consider elderly adults. Roughly 25% of all adults over the age of 65 have some degree of auditory processing difficulty. So again, if you see 10 adults and they are complaining of hearing problems, their family members say they really have struggle in adverse listening environments, and then you conduct an audiogram and it's normal, at least 3 or 4 of those people probably are going to have auditory processing disorders. So at the beginning of the workshop in May, I'll cover risk factors and also coexisting disorders that often are found in patients with auditory processing disorders. Now, even if you choose not to evaluate patients with auditory processing disorders, the first part of the workshop is going to be very useful to you, because every audiologist should know what to do with a patient who is at risk for auditory processing disorders. Then the next part of the workshop will focus on evidence-based strategies for assessing patients, children and adults with auditory processing disorders. We'll go over a test battery, and we'll talk about actual procedures that you can implement the next few days after the workshop in your clinic. It's really not hard to assess auditory processing disorders. You need an audiometer and you need some test materials, which you can easily acquire. So the test battery we will discuss is going to be evidence-based, and you'll actually adjust the test battery depending on the age of the patient and what your patient's complaints are. In other words, you customize the test battery. And that only takes an hour and a half or so to actually evaluate a patient. The final part of the workshop will focus on management or intervention for people with auditory processing disorders. And again, we'll break that down into children and adults. You know, one of the exciting things about working with these patients is that we're dealing with the brain, and the brain has plasticity. It's called neuroplasticity. And we can very quickly help people with auditory processing disorders. Actually, sometimes more quickly than we can help people with ear-related or peripheral hearing problems. So the management for APD can be incredibly effective, and it doesn't take too long. And very often you can actually change the processing of the brain permanently through the management. Well, that's kind of a quick synopsis of the workshop. It's a 2-day workshop, and I'll be joined, by the way, by another well-known audiologist from Australia, Harvey Dillon. You all know that name. And Harvey will be talking about some of his work in assessment and management of APD. I look forward to seeing you in Greenwich this May at the APD workshop. Thank you.